The importance of the WHO's work in the area of dementia is that it's a global public health priority. And the reason it is a global public health priority is because the large number of people affected by dementia, currently 47 million, and expected to or estimated to increase to 132 million by 2030. This is a large burden on communities in terms of the families that are going to be affected, and also the economic burden, which ADI has estimated to be more than 800 billion, which is high proportion of a country's gross domestic product. The third is the public understanding of dementia. Many people think it is normal part of aging. There is stigma, social isolation. The health and social care needs are not taken care of. Currently, there is no cure, but there is so much that can be done to help people with dementia and their families, and that's WHO's approach. So, for that, we published the big report on WHO ADI report on dementia, a public health priority in 2012. This was followed by and instigated actually by the G8 Dementia Summit in December 2013, the first ministerial conference where more than 80 countries, in fact around 89 countries participated, and issued a call for action, strengthening leadership, strengthening action, strengthening international efforts to tackle the global burden and the challenge due to dementia. So some of the activities that we are focusing on, these includes the prioritization of research for dementia and what should be the actions and taken in that arena. The second is the policy action on the continuum of care pathway, focusing on risk reduction, integration with the NCD policies. Third being supporting the dementia caregivers and their families through information and technology program. And fourth, through the Global Dementia Observatory, which helps the countries as well as globally to monitor what's happening and to strengthen the policies and practice at country level. If we look at impact, I think earlier people used to think that dementia is a problem only in developed countries, in high-income countries. Now, with the advocacy that's happening, there is increasing awareness that dementia is a global problem. The second impact is the awareness that much can be done about it. And this can be done at policy level, this can be done at resource level, the services and care delivery level by the countries, and this can be done for the research that is required for example, finding new diagnostics, finding new drugs to help people with dementia. And the important awareness that has happened is that much can be done to support families and caregivers. The other initiative that has emerged from the global awareness has been this movement of inclusion of people with dementia. So I would echo what was said in our session, that nothing for us, nothing for dementia without involving all of us, without involving people with dementia and their families. And that's very critical. If we really want to see a change, we need to involve people with dementia in all the activities, starting from policies to all the service delivery methods, including in the research. I can see lots of things happening in various countries. So for example, if you look at, follow other countries that have a national dementia plan. Earlier we heard only that many of the high-income countries had a national dementia plan. Now more and more countries are committing to it. For example, in the press we heard from Mexico what's happening in terms of their commitment. We also heard, I presented the discussion in the Kenya Senate on what has been happening in some of the other countries. And there is a opportunity as countries are moving forward on various activities and policies for aging, for mental health, for non-communicable diseases, that dementia will get the attention it deserves and demands, so that we can improve the care and improve services for people with dementia as well as their families and caregivers.